Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We're so happy you chose to spend this hour with us. We're going to continue exploring how to keep ourselves strong and healthy. And without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone. And again, another welcome to the new year that's moving real fast. We've had major representation at the Super Bowl, major representation at the Florida car races. It seems like our leadership is every place all the time. And today we want to talk again, continue our talk on things you put in your mouth, nutrition. And a lot of people are taking supplements, vitamins, and everything else. But we want to talk about what are the benefits and some of the things you need to know to keep yourself safe in light of those. And myself and my co-moderators will go through this presentation. Let's do this first slide, Simon. Okay, so we're going to talk about the benefits and the dangers of health supplements and vitamins. Today it'll be mostly vitamins, and we'll do another one that will have a bit more information than we do today. So we know that these supplements and vitamins are widely used for wellness, for performance enhancement, and disease prevention. However, their benefits must be weighed against potential risks, such as hepatotoxicity, which is something poison to your liver, the interaction with other medications and drugs that you may be taking. We also have to be very careful about what we take during pregnancy, because you can affect that fetus. So on the next slide, let's go to the next one, Simon. So vitamins and minerals, they are essential nutrients such as vitamin C, D, and iron, and herbal supplements such as ginseng, echinacea, and St. John's wort. So performance enhancers, protein powders, creatinine or creatine, and anabolic steroids. They're also, as you get older, especially, many people use sexual enhancers, herbal Viagra, L-arginine, and ginseng. Let's go to the next slide. Dr. Neighbor-Stephens, would you take this slide?
Sure, we're going to start talking about some of the potential benefits of supplements. So supplements can address deficiencies that may be in place, such as nutrient gaps. Vitamin D and iron are examples of gaps that can occur in our based on our diet or how shall I put this, other changes in our lives. Supporting overall health may boost immunity and bone health. Over the years, we've really talked about boosting our immunity. Not so much the bone health, but definitely the immunity. Enhancing performance. Some claim benefits in sports and cognition, and improving sexual health. Certain herbs are marketed for libido enhancement.
If you don't mind, take the next one, Dr. Neighbor-Stephens.
Okay. Now, some of these drugs, in fact, many of these herbs and supplements can have risk and undesirable side effects. The liver is subject to damage if too much green tea extract, black cohosh, or Garcinia cambogia are taken. And there are others, which is one of the reasons why we urge you to tell your primary care physician and all your providers any and all drugs, whether prescribed or over the counter, when you are engaging in your examination. Pregnancy risks. Some supplements may harm fetal development, so we definitely want to avoid those. Some can cause excessive bleeding. Ginkgo biloba is one that can increase your bleeding risk. And a lot of them will interact in ways that are harmful with other vitamins and herbs or prescription medications. Efficacy concerns may involve the fact that many supplements lack robust scientific evidence, and it may be in the next slide. They also do not have monitored certified content and strength.
Thank you. Dr. Walsh, would you do this one?
Hey,
Change
hepatotoxicity.
that slide.
I'm sorry. Where
Is
are
this,
we?
is this the right one?
No,
No,
that's
we
the
went
one I just-
backwards. Okay. Pregnancy risks is, I think, where we are. Yes?
Yeah, it should be.
Okay. Pregnancy risks. Caution advised. Vitamin A in too high doses can cause birth defects. St. John's wort may lead to miscarriage or preterm labor. And herbal teas, which is Dr. Neighbor Stevens talked about, so many items in this area are unregulated. And herbal teas, some of them may trigger contractions. Excessive vitamin D can lead to fetal abnormalities.
Next slide, Simon. Do this one to Dr. Walsh if you would.
Sure. Okay. Blood thinning effects. Ginkgo biloba inhibits platelet function and can increase bleeding risk. Vitamin E in high doses can enhance effects of anticoagulants. Omega-3 supplements may increase the risk of excessive bleeding. Okay. Next one.
We did a vitamin omega-3.
We did. I mentioned omega-3, and now we're looking at drug interactions. Beware of combinations. Vitamin K can counteract blood thinners, for example, warfarin. St. John's wort can reduce effectiveness of antidepressants and birth control medications. Calcium supplements can interfere with thyroid medications, and grapefruit extract affects metabolism of certain prescription drugs.
Especially high blood pressure medicine too.
And antidepressants for grapefruit extract.
Okay. Let's go to the next one, Simon. So, what does research say about efficacy? Vitamin C has no proven benefit for prevention of colds, but it might reduce duration of the cold. Vitamin D is essential for bone health, but there's little evidence for other benefits. Antioxidants, vitamin E, beta carotene, no proven role in heart disease prevention. The B vitamins are effective for deficiency correction, but there are mixed results in disease prevention. I think the main goal that we're talking about in these slides, don't just pop a bunch of pills because somebody says they're good. You got to make sure you talk to your primary care doctor, your healthcare provider, whoever they are, about everything, because you have no idea if things can help or hurt. Like, I know people take this emergency not knowing that it will cause problems. Please make sure you review with your healthcare provider what you're taking. Don't just take a mouthful of a handful of everything. Let's go to the next slide. Dr. Neighbor Stevens?
Guidelines for safe supplement use. Consult your healthcare provider. Always seek advice before taking supplements. Follow recommended doses. Avoid mega dosing. If a little bit is good, let me just take a lot more of it. It'll be even better. Now,
No.
if your provider tells you to increase the dose, that's different. Choose reputable brands. Look for third-party testing, USP, NSF certified. Beware of interactions. Consider how supplements may affect existing actions of medications that you may be taking.
You'd be kind enough to take the next one too, Doctor.
Vitamins and supplements. Excuse me. Vitamins are essential for metabolism, but many cannot be synthesized by the human body. Pre-vitamin D3 is synthesized via UV exposure. Vitamin K2 and B12 are synthesized by gut microbes. Those are the bacteria that live in our GI tract. Supplementation may be necessary in certain conditions, but has mixed evidence for chronic disease prevention.
To the next slide, please. So dietary references, intakes. This is DRIs. The recommended dietary allowance, or RDA, for daily intake sufficient for most healthy people. Adequate intake, or AI, not artificial intelligence, is used when RDA cannot be determined. Estimated average requirements, or EAR, EAR, nutrient intakes meeting 50% of population needs. So notice this is the general population, not necessarily you. There are tolerable upper intake levels, UL, maximum daily intake without adverse effects. Those are some of the measurements and terms you might see. Next slide, Simon. So vitamin deficiency and risk. Deficiency syndromes include scurvy, which is vitamin C, lack, pellagra, lack of B vitamins like niacin, and beriberi, a lack of thiamine. At-risk populations are elderly people, people who are strict vegans, alcohol-dependent individuals, and those with malabsorption disorders, people who don't bring the right nutrition in through their gut. Their chronic low vitamin intake may contribute to osteoporosis and cognitive decline and metabolic disorders. I know when I was in Harlem during my residency, almost every alcoholic got a big dose of thiamine. I think it was 100 milligrams in every liter of D5W, Barbara. I don't remember now.
They're still doing it.
Okay. Next slide. You want to do this, Dr. Neighbor?
Okay, vitamin D and chronic disease prevention. Vitamin D is essential for bone health and calcium absorption. It may reduce fall risk in postmenopausal women. The potential role in preventing type 2 diabetes in pre-diabetic patients, something that is being explored, and mixed evidence for benefits in cancer, autoimmune diseases, cardiovascular disease, and dementia.
Okay. Dr. Walks?
Antioxidants, something we hear a lot about in the general news. Benefits and limitations. Common antioxidants, vitamins A, C, and E. Observational studies link high fruit and vegetable intake to reduced cancer and cardiovascular disease risk. randomized trials fail to show consistent benefits from antioxidant supplements, beta carotene supplementation may increase lung cancer risk in smokers.
That's an important slide, I think, especially that one. Again, we emphasize the fruits and vegetables seem to be, everybody says that's good. I haven't seen anything that says not good.
No, Dr. Maxey, when we present this kind of information, so much of it is really dependent on what else is going on in the individual person's life, right? Their age, their diet, their other health conditions, the stability of some of their other health conditions. And so it's just really important. And I know we've mentioned it several times already, and we'll probably mention it several more times to make sure that your primary care practitioner knows what you're eating and what you're supplementing with.
Very good. Let's go to the next slide, Simon. Vitamin A, benefits and risks. Vitamin A is found in liver, dairy, egg yolks, and carotenoid-rich vegetables like carrots. It's essential for vision, immunity, and cellular differentiation. High doses are linked to increased hip fractures, risks, and birth defects during pregnancy. Supplementation generally is not needed in well-nourished individuals and people in the population. So again, here's something that good in normal people, but you don't necessarily have to supplement it. It is something that's essential, but if you're having pretty much what's considered a regular diet, that's not something you want to pop 10 tablets of vitamin A because it can cause problems, and especially if you're pregnant. Let's go to the next slide. That's Neighbor Stevens.
Vitamin C and immune function. Vitamin C is found in citrus fruits, peppers, tomatoes, and greens. No evidence it prevents colds, but may slightly reduce the duration. High doses can lead to kidney stone formation due to oxalate accumulation. No proven role in chronic disease prevention.
So how does this play in with what we call that emergency stuff? Is that a high dose in particular?
I don't know what's in emergency. I'm assuming it's vitamin C. And I would imagine it's at levels higher than normally consumed, but I don't know.
So I noticed there's a caution for people who use these diabetic control monitors that are implanted in your arm, that they tell you don't take emergency because it'll make your readings come out wrong. So it interacts with the way that these measure your blood glucose. So again, talk to your physicians. I mean, you don't want to take something that's going to make your measurements off in those devices. Next slide. Dr. Walks.
Vitamin E, risks and benefits and risks. Vitamin E found in vegetable oils, nuts, seeds, and green leafy vegetables. No consistent evidence for preventing cancer or cardiovascular disease. High doses greater than 400 international units a day are linked to increased mortality and heart failure risk. And high doses may interfere with anticoagulants and increase your bleeding risk.
So that's another problem there that I've seen a lot of people just pop these vitamins. I've been so upset. Like Barbara says, one is good, so 10 must be better. Next slide.
All right, so next slide. B vitamins, heart and brain health. Vitamins B6 and B12, and also folate, lower homocysteine, but no clear benefit for preventing heart disease. Folic acid supplementation prevents neural tube defects in pregnancy. There's mixed evidence for B vitamins in cognitive decline prevention, and high folic acid intake may mask B12 deficiency.
So the reason this is important, Dr. Walsh, for several reasons. I know people come in my office, can I have a B12 shot? I need some energy. The first thing I know that not only can B12 cause problems, but until it gets peed out in about an hour, that's all it lasts. It's not something that's going to last you until your next visit in 3 months. So you're getting stuck for nothing, even though the needle is small. And we do use folic acid a lot in patients with renal failure who are on dialysis because the dialysis process takes out folic acid. So we have almost all dialysis patients on folic acid 1 milligram a day because it's taken out with each dialysis, which is 3 times a week. So, but they say it can also mask B12 deficiency. Next slide, Dr. Neighbor.
So in conclusion, we are urging you and trying to inform you with information so that you can make informed decisions. Supplements can be beneficial, but must be used with caution. Always research potential risk, interactions, and efficacy. Prioritize a balanced diet before relying on supplements, and consult healthcare professionals for personalized recommendations.
And once you take the last slide, Dr. Neighbor.
Guidelines for safe supplement use. Focus on obtaining nutrients from food first. Use supplements only when medically necessary. Avoid megadoses unless prescribed. Be cautious of interactions with medications.
Yeah, I think that's the last slide.
That is the last slide.
Okay. Let's close the slides and see if there are any discussion points. Any questions or comments in the chat, or anybody want to add something more?
While Dr. Neighbor Stevens is doing her expert job of scouring the chat, I just want to add that this is a particularly challenging place because so many of these supplements, as you mentioned earlier, Dr. Maxey, because they're not regulated, folks are more vulnerable to a lot of the advertising that goes on. So as folks advertise, for example, you mentioned emergency. It's not emergency, it's emergency as a particular one. It's important for folks to know what they're taking. And something we haven't mentioned, I think there's another point in the chat about another one we haven't mentioned. We didn't mention zinc today, which a lot of folks take for immune benefit. So
Good point.
Could we unmute Dr. Steiner? He is raising a question about another one that we did not.
Does
Okay.
maple syrup have vitamins in it?
Well, good afternoon, everybody. This is
afternoon.
hi. This is really an interesting topic, and I think you hit all the high points. And then one of the questions first, before I get into the chat questions, is you touched on certifications for different vitamins. And years ago, I knew a physician who was prescribing lots of these to his patients. And I traced back the origin of his vitamin supplements, and they all came from China. And then I went further than that. I spoke to my friend who was very high up in the Chinese government with medications and their SFDA certifications, et cetera, just like our FDA. And he told me that those types of supplements are made from Chinese raw materials that are shipped in open boats, in the hulls of boats and scooped out by the tons. And then in this country, they're manufactured into supplements like we're speaking about and packaged. So, Dr. Maxey mentioned following the mainstream, and I buy my supplements at Costco, figuring that they're Kirtland and they're probably looked into in a deep way, but maybe I'm kidding myself. So I wonder if you could give us more security in our own purchases. Maybe someone in the audience or on the panel has a special source that they're very sure about. And if they could share that with us, I would be most grateful for that.
So I'm going to step out on a limb and call somebody's name I see who's in Ohio. I see Mr. Mark McDougall. Can you be unmuted? I think I talked to you about some vitamins. Is Mr. McDougall there?
He's
Simon?
unmuted.
Yes.
And then, of
Hello.
course, I want to call on Dr. Gibson, too. Mr. McDougall, you have some vitamins you take, right?
Yes, sir. I'm on what is called Herbalife,
Mhm.
and my experience has been positive for the most part. Also, my primary care physician uses Herbalife as well. So when I go twice a year for my physical, everything checks out okay. I've had, some problems in the past. I'm a cancer survivor, prostate cancer, and I'm on gout. I have gout, so I have to do things for that as well. There's a number of companies that are what are called nutraceutical companies. And what has happened is that for a couple of them, they were under attack by the American Medical Association. And so there was a series of hearings that happened and these companies felt that they were trying to be eliminated by the government. Also concerning the use of the ginseng root, it is illegal to talk about the medicinal properties of the ginseng root in the United States. In spite of the fact,
It's illegal?
the American Medical Association lobby in Congress is responsible for that.
So there's a law against it?
Yes, there is. You can talk about ginseng. You can say, well, I think it's good. I like the taste of it, da, 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 da. If you begin mentioning the medicinal properties about that, in spite of case studies done in a number of different countries, you are in violation of the law.
Now, I didn't know that. The majority of this information came from one that most physicians use. It's called Up to Date. And they had extensive information on ginkgo. So we'll have to talk about that. Is Dr. Gibson on?
Dr. Gibson is on, and Dr. Sherrod has her hand up to make a comment.
Okay, which one can we unmute first?
Dr.
I'm here.
Gibson's unmuted.
Thank
I'm
you,
here.
Mr. McDougall. Dr. Gibson?
Yes. Hi. I put excuse me, a quote in
Dr.
the
Gibson
chat.
is our resident pharmacist.
I put a quote in the chat from the gentleman who wrote the now famous oath of Hippocrates that physicians take when they begin their medical practices. And he said, let thy food be thy medicine, let thy medicine be thy food. I say that, I quote Hippocrates only to remind you that because sourcing is an issue, I believe it was Dr. Walks that mentioned earlier, it's not regulated. The industry, the nutritional supplement industry is not regulated properly or regulated at all for that matter. And so for that reason, we're at loggerheads in terms of trying to make decisions about nutritional supplementation if we choose to do that rather than get our nutrition from our food. But I as a pharmacist, would strongly recommend that we educate ourselves or seek education on where to get the proper nutrition sources from our food, whole foods in particular. Now, when it comes to whole foods and actually when it comes to good vitamin supplements, that can be pricey. So it may be out of reach of the so-called lumpen proletariat in terms of pricing. So maybe an affordable uh, brand of supplements would be, I've recommended for years, Nature Made. Their prices are usually within reach, as well as whole food supplements by Garden of Life. Those are two brands that probably most folks on the call are familiar with, and they are not priced, as if they're on the shelf at Whole Paycheck. So that would be my contribution for today. But I'd say whenever it comes to taking supplements, or for that matter, anything that you're going to put into your body, in your mouth, in your ear, in your eye, all of it, you have to remember caveat emptor.
All right, thank you so much. And
So
Dr.
wait,
Sharad?
Dr. Maxey, before Dr. Gibson goes away, I have a pharmacist question. Dr. Gibson, in the chat, is a question about if there are no other conflicts or any other problems, can you break or pulverize liquid gel caps? And if you do that, will that increase the absorption of what's inside of liquid gel caps?
Uh, yes and no. You can and I hate to answer that like an like an advocate, like an attorney, but on the one hand, yes, you can get access to liquid, but then you've compromised the product.
Hmm.
Once you open that gel cap, that's a compromised product. So I would never do that, because then your dosing it cannot be certain, because you're gonna waste. And I use the word waste not lightly, because supplements are expensive, man. That's
Yeah.
why I try to mention the ones that are within reach in terms of pricing, like Nature Made and Garden of Life on the whole food side. And so, yes, you can infiltrate that capsule, but you're going to ruin whatever benefit might have been there before that. And so I'm not sure if that addresses your concern or.
One other quick question, Dr.
Mhm.
Gibson, because I love to ask questions from the
Mm.
experts. Uh, so Dr. Steiner mentioned earlier that he will sometimes get his Kirkland brand in Costco, and I'm surprised I haven't bumped into him on the vitamin aisle at Costco because that's where I go to get my
Right,
to
right,
get my
right,
Kirkland brand. I can get a big bottle for a low price.
right.
So, do you know, or have you had experience with whether some of the big chains like Costco are they actually checking what they're selling us, or we just don't know?
Well, we don't know.
Okay.
We don't know. And I hate to say it like that, but I don't, I really, from my vantage point, I cannot confidently and honestly say that they're checking that. What Costco's in the business of making money.
Mhm.
That's the business. So the bottom line is determined by the best price, and
Okay.
what the alpha is between, what the difference is between the cost of acquisition and the cost of sale. So they have good products, and most of them are I would consider uh, within reach on the price side. But again, in terms of whether they, to my knowledge, I don't know of any actual quality control there. Now, when you get into major pharmaceutical firms, they by law have to I cut my teeth in one of the major pharmaceutical firms, quality control labs. They're required by law inside those big companies to
Mhm.
check.
Okay.
But whether or not they actually go back to sourcing and what have you in the big boxes, big box stores, I don't think so.
All right, Dr. Steiner,
what
you
Dr.
and I are
Rod-
on our own. You can go to Costco at your own risk.
Dr.
That's what
Gibson,
Dr.
don't leave
Rod-
yet, because we have a really good question in the chat that I want to throw your way. It says, remembering when pets were dying because byproducts of no health and nutritional value were added to weight of food processing, but such added products were detrimental to the pet system. What elements on labels should we look out for and avoid in our supplements?
Well, they were actually, some of them were mentioned earlier in our discussion today. You have to be careful on all of the, shall we say, fat soluble supplements. That would be A, D, E, and K. ADEC, it would be an acronym to remember. Those we have to be extremely careful with. And also ascorbic acid or vitamin C. That one as well, because we have, the body is an incredibly intricate piece of engineering, whether we're talking about a human being or a smaller mammal, a cat, a dog, or cow, or whatever. So we have to be mindful of the chemistry and how it changes, not only after ingestion, but before ingestion. For instance, somebody mentioned something about the food that is fed to cats and other pets. Well, there is much less vigilance in the source of nutritional benefit when it comes to pets. So they don't have the benefit of the kind of scrutiny that we, shall I say, used to have, or maybe may not have, uh, at least for the next 4 years, 3.5 years, or whatever. I digress. My point is, again, when it comes to our pets and what have you, as mammal friends, we have to be even more careful in sourcing of their foods.
Thank you, Dr. Gibson.
Sure.
Dr.
We're
Sherrod,
waiting
is
on Dr.
everybody-
Sherrod, is that correct?
Yes.
Oh, good afternoon.
Good
Again,
afternoon.
commendation for a great topic, Dr. Maxey. I have a few comments. One in relationship to what Dr. Steiner was asking about safe places to get supplements. One of the most, I think, the most reliable, or considered one of the most reliable in the integrative medicine community, is Life Extension. Life Extension actually will provide you with the data to support the recommendations for their supplements. So that's number one. They actually even have a journal that they send out quoting the data that supports the use of this supplement. Secondly, there's a place called WholeScripts. WholeScripts is actually, you can only get these supplements through physicians. And an arm of WholeScript is called Zymogen. And also your physician would have to order that supplement. So there's some protection there. I think the thing that we have to, it would be great if we could get all of our nutrients from our food, but especially in our country, in America, the farming techniques have distorted the soil to the point that it's now depleted of a lot of the nutrients that we need to exist. That's because of the money-making efforts turning over the fields too rapidly so that they don't have a chance to replenish themselves. The second thing we talked about earlier this month, and that was chemical nutrition that we have here, a lot of in America. Highly processed foods and just regularly processed foods. If you want to get the true nutrients, you got to get them from the soil. There are a few other comments that I have, and one is concerning coenzyme Q10. You didn't mention that, and that's the supplement which is actually recommended if you're taking one of the statins, because a lot of the pharmaceuticals deplete nutrients from individuals, and every pharmaceutical we take has a side effect. So I think you need to also be aware of what pharmaceuticals you're on and what supplements you need to make in order to make up for the deficiencies that are being created by a lot of the pharmaceuticals. The other thing I'd like to say is that B12, the type of B12 that we are familiar with and that is most frequently used in the United States is called cyano B12, which is the cyanide molecule is a poison in itself. And I've learned a lot because I have the diagnosis of chronic fatigue syndrome and fibromyalgia, which pharmaceuticals I have a major problem taking. And if you look at this group of chronic fatigue, ME, and all, many of the pharmaceuticals do not work in the case of these particular chronic illnesses. So there's also the autistic group of people with the spectrum and the autism spectrum. B12 has been shown, and there's data to support that it enhances the cognitive function of kids with autism, as well as vitamin C is considered to improve immune function in these kids. But I want to give you the other types of vitamin B12, and that's methyl, which crosses the blood-brain barrier, and that's the only B12 that crosses the blood-brain barrier. Hydroxy and adeno B12, and they are used a lot in treatment of patients with chronic fatigue syndrome, fibromyalgia, and autism.
Thank
The
you.
other thing is, is the antioxidant. You talked about antioxidant, glutathione, and there's a book called brainrecovery.com, which was written by a neurologist, a very renowned neurologist, Dr. Perlmutter. And he actually demonstrates the effectiveness of glutathione in managing Parkinson's disease. The other thing is zinc. You mentioned, somebody mentioned
zinc. I
zinc.
get other people in too, Dr. Sherrod.
Yeah, okay. I'm rounding up here. Zinc, very important, antimicrobial, but quercetin is necessary. It facilitates zinc getting into the cells to do its action. And then you kind of left out the anti-inflammatory group of supplements like turmeric and bromelain and all of that. And then there's one that a neurologist prescribed, which is Delphin, which is that you can actually get from a pharmaceutical. My neurologist gave it to me. It works in folate metabolism. So I think it's very important that we brought this lecture today because, like you say, there are a lot of high points that were pointed out, and you do have to be careful, but not only with vitamins, you have to be careful with pharmaceuticals. Thank you for your time.
Thank you so much.
That is very helpful, Doctor. That is very, very helpful. I think that what Dr. Sherrod just did was let us know it ain't that simple. We really do need to talk to the experts about it. Thank you, Dr. Sherrod.
Thank you. There are several other people on. I want to make sure that the information gets put in the chat. Mr. McDougall, if you put your information in the chat about where you get your medication, so that way people can do research on their own. We couldn't be totally comprehensive in what we put up today because we only have an hour. And I see Dr. Lisa Dawes, if she's not at the beach.
Dr. Lisa Kirven-Dawes is always working. Every time she is on with us, which is almost every Sunday, we've got to get her between emergencies and urgent calls. So she is busy.
Okay.
Dr. Lisa.
Hello, yes. There are a bunch of vitamins. I mean, Jamaica, we actually use, I do integrative medicines, but in Jamaica, we use a lot of herbs. And we also use a lot of vitamins. Yes, we had quercetin, and I think everybody's using more quercetin, especially since COVID. I came in a little late because, yes, I was in another meeting. but magnesium glycinate, that's one that I think most people should be taking. Did we talk about that already?
No.
Okay, so magnesium glycinate is well absorbed, but you need magnesium actually to help stabilize your nerves. It's actually very good for the brain and it's good for blood pressure. So if your magnesium levels are low, you have a difficult time controlling your blood pressure. And since some of us are doctors here, we know we use it, we give it extra if you're having an asthma attack, if you're having arrhythmias, seizures. In fact, most of our seizure patients, we put on over-the-counter magnesium. So that's one of the supplements. I think you already talked about CoQ10 because everybody who is on a statin should be on it. A lot of regular people should be on it as well. You can do NMN or NAD. I think some people talked about glutathione, which is the precursor. There are very few vitamins that will give you the glutathione that can last. I mean, there's some now that are doing what you call it, swish and swallow. So, because glutathione is broken down by your gastric acid, and that's very important for your brain. But there's a long list, is whether you get them clean or not. Some of the magnesium, for instance, comes from China, and you're getting other toxins in it. So you really have to look where your vitamins are coming from. But there's a whole list of vitamins now that are advised for people to take. I mean, we could have a long discussion because I actually take quite a few.
Well, thank you so much. So we're just about at the top of the hour. Are we at the top of the hour, Dr. Neighbor-Steven? We're close.
We're close, not quite there, but we're very close.
Any more comments in the chat?
Some more questions and comments that, what about this supplement? What about this supplement? Whenever we have this topic, we run out of time because there's so many supplements. And the topic really deserves in-depth understanding of what the true data is and what the versus what is an observation or a case study or we need to be disciplined as we discuss this subject, because we can easily hear something and decide this is something that we want to take away. So I want to emphasize that we are not recommending any of these supplements, but we are encouraging you to read and educate yourself. And, we're always telling you read labels.
Perfect. One of the first people to ever give me a book on life extension, you might remember him, Dr. Sherrod, is Dr. McCoo. He's the father of Marilyn McCoo, the singer. And he gave me a book as my present when I first started practice. So there's a lot of good information in there. So I'd like other people to put the information in the chat. And we got about
one quick thing. I think Dr. Gibson said we need to eat our foods. I mean, one of the things that now we talk about turmeric a lot, and turmeric and black pepper, but that's curry, and you eat curry a few times a week. You're decreasing your inflammation. So there are a lot of foods, and I think we do that more in Jamaica, that now we're just pulling the supplements out. And one of the things that we've noticed is sometimes when you just do the individual supplement, it doesn't work as well as when you actually eat it in the whole food. There are other things that the whole food does to it that we don't know yet.
Very good. Why don't we go for our ending comments? Starting with, we haven't heard from Dr. Lawson today. Is he here?
I didn't see him.
Okay. So Dr. Gibson, you want to make final comments before Dr. Walks and then Dr. Neighbor-Stevens?
Yeah. Yes. I think CoQ10 has been mentioned several times. There are some folks that like to take Reddy's rice for the natural approach to the statin need, but it's extremely important to balance that whenever you take that Reggie's rice, to balance it with CoQ10. And the amen and amen to Dr. Kervin Dawes when she said, eat your vitamins. And for you to properly do that, you must educate yourself. And there's no substitute for learning it yourself. You read it, you search it out, you memorize these facts, and be careful where you get your information. Make sure that they're well, we used to be able to say government sources, but look for professional publications. There are several of those that's still around: AMA, NMA, American Pharmacists Association. Those are good resources that you can get information still, even despite the changes. So thank you.
All right. Dr. Walks? Is Dr. Walks muted?
Yeah.
Can you unmute Dr. Walks?
I'm now unmuted. Thank you, Simon. I thought Simon was mad at me because I like all the Marvel movies. I love you, Simon. Thank you. I think that this really lends itself to just a complicated thing. And when we are on Black Health Trust, we understand that we're speaking to physicians, we're speaking to pharmacists, we're speaking to other health professionals, and we're speaking to regular folks. And I don't know how we expect anyone to figure out what particular supplements are right for them unless they are, as Mr. McDougall said, getting that regular checkup. Twice a year, he goes to see his doc and he gets himself checked out. You really do need someone who is keeping up with the literature and who is keeping up with you. And that combination of keeping up with the literature and keeping up with the individual allows your practitioner to help you with making all of these decisions. Otherwise, I don't know, I would just throw my hands up because it's too much and it's too complicated. So get that practitioner that is going to follow you, see that person regularly, and make sure that when you walk into the grocery store, I see Dr. Gibson just put what I was going to say in the chat. Stop by and meet your pharmacist. Stop by and meet your pharmacist. That person has a tremendous amount that they can share with you.
Thank you, Dr. Walks. Dr. David Stevens.
Well, we're at the top of the hour, and I'm going to keep mine short and sweet. And I have said this before, source and reliability. You're talking about what you're putting in your mouth into your body. So you want to understand the source of the information, the source of the substance that you're putting in your mouth, and the reliability of the source of information that you're tapping into.
Well, thank you. My final comment is going to be about a question. Have all the websites that we used to use, like CDC and the health trackers, are those all taken down now by the current administration? Does anybody know that?
Last I looked, the CDC website is up, but it is altered.
Okay. So we have to have, I know there've been a lot of information now to try to go and make sure you download some of this information so when it does go away that it's still good. We're trying to do some of that. I'd like to appreciate everybody who's been with us today. We'll be back next week with another topic. Have a great day, and thank you very much, Simon. Thanks everybody for participating. Have a great day.
Bye.
Good day, everyone.